Across the country today, nurses held a day of action. They're demanding that the hospital industry invest in safe staffing. They also want the Biden administration to follow through on campaign promises to protect nurses and prioritize public health. But in California, nurses are also taking up a new fight with the California Department of Public Health. BNC correspondent Anser Hassan joined us now live with more on that. Good afternoon, Anser.
Good afternoon, Laverne. The California Department of Public Health says, as a last resort, healthcare workers who test positive for COVID-19 and who are asymptomatic can return to work without isolating and without testing. And on this day of action across the country, nurses here in California say these new guidelines go against CDC guidelines.
Hey, hey, ho, ho. Short staffing has got to go. Hey, hey.
On this National Day of Action, nurses in California are demanding safer working conditions.
The biggest concern is just how they're treating us in the facility. Our staff is not good, so you keep hearing on the media that there's a nursing shortage, that they don't have enough nurses to cover. That's really not the truth.
Robin Watkins is an ICU nurse. He's worked at Kaiser since 2014. He says the problem is not just a lack of staffing, but misallocation of staffing resources. As he explains, after the last round of contract negotiations, a new system was implemented to staff nurses. Since then, they're still coming up short-staffed.
On average, we were short like 2 or 3 nurses a shift throughout the region. So all the Kaisers were short.
But he says despite negotiations, the system still has flaws, and the pandemic just made the problem worse.
We are the nurses.
But as emergency room nurse Stacey Eddy describes it, this is just hospitals trying to save money by making nurses do more.
I believe corporate greed is seeing that we're going to take care of patients at the end of the day no matter what. So we're going to make it happen. And they're seeing that we're able to get by with less, so they're allowing us to just keep working with less.
Another concern are new guidelines from the California Department of Public Health, or CDPH. It allows healthcare workers who test positive for COVID-19 and who are asymptomatic to return to work without isolation or testing, but only as a last resort. Some medical experts argue there is precedence for doing so in previous epidemics.
Mine will be show me the science. Show me the science in which you state that it's okay to roll these things back.
Watkins disagrees with the decision, saying that more nurses are getting sick since the rollback started. On Monday, Kaiser issued a statement to BNC saying, quote, Kaiser Permanente's current policy for returning to work after COVID-19 exposure is consistent with CDC guidelines and remains in place as we actively review the new CDPH guidance. Eddy thinks the move by the CDPH goes against the current science.
Because we're going to be out sick, and now that we're coming back sick, that's not safe for anybody. You can't go from 10 days to now you're saying 5 asymptomatic. Your viral load may still be shedding. It's evident. We have so many nurses out now sick.
Now, Lauren, about 20 minutes ago, we just got a written statement from the California Department of Public Health. In it, they say that these guidelines are only temporary and that hospitals have to exhaust all other options before using this tool. They also say that asymptomatic COVID-19 workers are the only ones to interact with COVID-19 positive patients and that they have to wear an N95 mask. Reporting live, Anser Hassan for BNC.
Anser, thank you so much for that report.